Hello friends and welcome back to my channel Malik Helps. In this video we are going to talk about meningococcus infection, meningitis or mucovisidosis or cystic fibrosis, riboflavin or vitamin B2, Marfan syndrome, phlegmon of the newborn and hyperprolactinemia. So let's start. Meningococcal infection. So meningococcal infection is a serious bacterial infection caused by Neisseria meningitis, which is also known as meningococcus. So what are the symptoms which we are going to see in the patient? So patient will present with the fever, chill, headache, stiff neck, the photophobia, altered mental status, difficulty in concentration, nausea, vomiting, and the main highlighting factor here is rash on the buttocks and legs. This is what we are going to use in the question: stiff neck plus rash on the buttocks and legs. So let's see some patients. So 21-year-old having fever, headache, chill, repeated vomiting, rigidity of the occipital muscles, and analysis of the liquor revealed cytosis including 84% of neutrophils. So neutrophils highlight which infection? Bacterial infection. So bacterioscopy detected gram-negative cocci found in the liquor. So sir, the gram-negative cocci is which one here? Which is meningococci. So they also highlight about the neutrophils in the question, that they are 84%. So we are sure that it is a bacterial infection. And the stiff neck portion is given here, the occipital muscle, the rigidity of the occipital muscle. So this is the case of meningococcal infection, purulent meningitis. Let's see the next patient. Next patient says about the temperature, chill, weakness, inertness, skin pallor, headache. 8 hours later, hemorrhagic rash developed on the skin of the buttocks and legs. So remember from the definition portion, what we are using in the questions: stiff neck and rash over the buttocks and legs. The rash is petechial. So let's go next. Next is the patient says about the the rash over the buttocks and the lower limbs. So the another thing is hemorrhagic elements have necrosis in its center. So remember that which type of rash is having the necrosis in the rash? The meningococcal rash, which is also known as the petechial rash. Next is the question about the drug of choices. So there is a meningococcal fulminant foam. A lot of foams are there for the meningococcal, but remember from the croc question that meningococcal fulminant foam is something most dangerous foam, that it will give the patient as a infection, as a toxic shock. So first line treatment for this according to the croc question is levomycetin succinate, soluble levomycetin succinate. So you have to remember guys that the fulminant form of meningococcus with toxic shock syndrome is treated by the pills of soluble levomycetin succinate. Next is about the meningococcemia toxic shock 1 degree. So when the patient will say that meningococcal toxic shock 1st degree is there, so what you are going to give as a drug of choice? So this is chloramphenicol succinate and prednisolone. So remember from the last question as well that preference for the croc question is something succinate. So remember about levomycetin succinate and the chloramphenicol succinate. These are the strong antibiotics guys, that in the cases of meningococcal infection we use some 2 to 3 x stronger antibiotics than usual infections. So I hope you will remember this. You have to remember the name of these two, that something succinate is the solution for the meningococcus infection in the croc question. Next is mucovisidosis, which is also known as cystic fibrosis. So cystic fibrosis is a genetic disorder that primarily affects the lungs and the digestive system. This is caused by the mutations in the gene CFTR. If you can remember, it is good. Otherwise they did not use it in the croc questions. So cystic fibrosis, transmembrane conductions regulator leads to the production of thick sticky mucus. So the question will be given, a lot of mucus will be there. The question will be full of mucus. So symptoms which we are going to see in the patient is chronic cough, because a lot of sputum should be there. Yeah, frequent lung infections, so these patients are more prone to the infections. Wheezing and shortness of breath, sinus issues. Digestive symptoms will be a pancreatic insufficiency, malabsorption, poor weight gain, meconium ileus, blockage in the intestine due to thick meconium. Other symptoms, this is something main which we are going to use in the croc questions. So salty skin will be given in the question. So sweat chloride levels more than 60 will not be normal. They should be less than the salt chloride levels should be less than 60. All right, so in the patient will be given more than 60, which will be the case of cystic fibrosis. Let's hear it from patient. So the first patient says that he is having, it is a 3-year-old child. So he is having weight deficiency, permanent moist cough, history of pneumonia, obstruction, dullness over the lower parts because the fluid is over there, pneumonia, as we know that there will be frequent infection history. Weight deficiency will be there in the cases of mucovisidosis, moist rail, level of sweat chloride more than 60. So we know from the introduction portion that more than 60 will be the case of mucovisidosis. So you have to remember, friends, that the question or the examiner will not always give you the cystic fibrosis in brackets. So you will have to remember that the cystic fibrosis is also known as mucovisidosis, in which the question will be full of sputum or pulmonary edematous case type, and the question will be given sweat chlorides level more than 60. So next patient is also a 3-month-old child, complains about the cold attack, dyspnea, child as a result of full term or second pregnancy. Next, cough attack on the first day of life. Twice the child was treated for bronchitis. So in this question they did not provide us with the salty skin levels, but what they given is the respiratory symptoms they have given, mucus they have given in the question, the cough attacks observed in the first day of life. The child is twice treated for the bronchitis. So the patient is prone to the infections, which is a case of mucovisidosis. So remember, in this question the salty skin or salt chlorides are sweat chlorides are not given in the question, but you can remember through the child that was twice treated for the bronchitis, he is prone to the infections. And also in the first line they say physically underdeveloped. So we know that physical underdevelopment occurs in the cases of mucovisidosis, which is a genetic disorder. Next patient says about the sweat chloride levels, so and also the bronchial obstruction history. So we know about the case will be of the cystic fibrosis. However, the question also says something about dyspepsia, which means the digestive symptoms like abdominal pain, bloating, nausea, heartburn, early satiety, in which the patient feels early satisfaction through the hunger and ingestion. So if you do not remember these all symptoms, just remember that salt chlorides will be elevated in the cases of cystic fibrosis. Next is vitamin B2, which is also known as riboflavin. So this is a water soluble vitamin which plays a crucial role in bodily functions. So the main thing to remember for the croc question is that deficiency will lead to cheilitis, which is the cracked lips and corners of the mouth. So here is our case study. The patient is a student who presents with the cheilitis in the area of lip seal. Lips are bright with cracks covered with the brown red scabs. So you know guys that cheilitis is caused by the deficiency of vitamin B2 or riboflavin. So remember about it. Next is Marfan syndrome. So a lot of symptoms are there, you can remember all of them, but the main thing to remember is this one, that the patient will be tallly grown. So let's hear it, that this is a genetic syndrome or disorder that affects the body's connective tissue, which provides further supports to the bone or blood vessels. So the patient will be tall, the patient will be having cardio symptoms, the patient will be having the risk of cataract or ocular symptoms, the patient will be having stretch marks or striae. So the main thing to remember guys, that in the croc question the patient will be tall, and as you can see in the case study, that the 14-year-old girl, she's having tall stature, striae on the skin of abdomen, blue sclera. So ocular symptoms are there, striae on the skin are there, tall stature is there, fingers and arms are long, so again the tall stature. The cardio symptoms are there, mitral valve prolapse. So what is most likely due to her tall stature? So the cause is Marfan syndrome. Next is phlegmon of the newborn. So what is phlegmon? So phlegmon is a infection. It's a bacterial infection of connective tissue in newborn, typically involving the skin and the subcutaneous tissue. Sir, what are the symptoms we are going to see in the patient? So the patient will come up with the swelling and the infection profile, like the fever and pain or edema swelling or shin skin. So more common for just remember for the croc question, that erysipelas was more common for the leg portion for the croc question, and phlegmon is more common for the lumbar portion. So you can see all of the symptoms, and severe symptoms can be there: abscess formation, necrosis. If the bacteria spread to the bloodstream, then it will cause a severe symptoms. Let's hear it from the patient. Patient is 8-year-old, having regurgitation, temperatures, lumbar area. This is what I just wanted to highlight, that phlegmon is more common in the area lumbar. So med history having no peculiarities, severe condition, inert, pale, suckles poorly. Let's see the last line. A tense infiltration with the hyperemic and cyanotic area with a soft spot 8/7 in its center. So stool 10 times a day in 24 hours, green and admucous mixture. So sir, you can notice that the patient is having some infection because the bowel movements are changed, the fever is there, a tense filtration with the hyperemic area. This is the formation of abscess or necrotizing area. So sir, this is the case of phlegmon of newborn. I hope you will be able to understand it very well now. Next is the case of hyperprolactinemia. So what is hyperprolactinemia? Abnormal high level of protein in the blood. Who produces the prolactin? Pituitary gland. What it is stimulating? The breast production or the milk production in the pregnant woman or post-pregnant women. So symptoms we are going to see is irregular menstrual cycle, amenorrhea, a milk production not associated with the childbirth, that the woman is not post pregnant or post delivery, but still the milk discharge is there. Infertility, decreased libido, men will see the erectile dysfunction. However, hyperprolactinemia is most reported in the females. So other symptom: headache, visual disturbance, infertility in males, among males as well. Let's hear it from patient. Patient is 30-year-old female, as it is more common in female. Milk discharge from the mammary gland 5 months of the absence of menstruation. So the woman is having active menstrual cycle, but the age is 30, and so the woman is having active menstrual cycle, but she is feeling absence from the 5 months. So next, mammary glands are normally developed, but still the milk is there and discharge is there, which is abnormal here. So no cerebral pathologies, and concentration of thyroid stimulant hormone is normal. It means the thyroid hormone is normal, which could also cause the problem with the menstruation, right? So the question highlighted that thyroid gland is normal. So serum prolactin level is increased. So our question itself is screaming that, sir, we are having hyperprolactinemia. So I hope this is clear now. This is it with this video. I hope you have got my point. If there is something, let me know in the comments. See you in the next video.